not running for president to put Band-Aids on our problems. I want to get to universal health care for every single American.
Well, is healthcare for everyone, whatever you think about it, wise in this environment when the economy could be slowing down, maybe even recessioning down? Well, Carrie Lukas says no. She is with the Independent Women's Forum, but civil rights attorney Angela Aliotto disagrees. Carrie, to you first, not a fan. Why not?
Well, I mean, first of all, we have incredible budgetary pressures coming, looming just around the horizon. With Social Security is going to be running a deficit in less than 10 years. We have the incredible cost of Medicare coming down the pike as the baby boomers begin to retire. The last thing in the world we need is to massively expand government's liabilities by increasing government provision for health care. And not only that, not only is it terrible for the federal budget, it will be, in many ways, it can harm the quality of health care that many of us enjoy in the United States today. It's the absolute wrong direction for our system.
Angela?
The many of us that enjoy it today are those that can afford it today. I absolutely love what Hillary Clinton said this morning. Every single American should have health care, and it is incumbent upon the government to do it. You know, there's always the sky is falling if we do this. And then it turns out that when you actually implement it, the amount of savings because of the preventative medicine, the amount of savings because you've taken care of someone at a stage where it costs nothing, not to mention the moral obligation to take care of that person, but the fiscal, the financial obligation is little money at the beginning, and then it becomes hundreds of thousands of dollars. So when you stop it at the beginning with health care, with universal health care, so that the person has the ability to go and get this preventative medicine, you save millions and millions of dollars. And it is amazing to me the lack of vision in people that don't think that this indeed will save money.
But Angela,
as opposed to
it might,
spending.
let's say it saves money longer term. There are many people can argue that point. Do you do it when the economy could be slowing down and putting these burdens on businesses when they might be able to ill afford them?
You know, Neil, I personally feel it's a moral obligation.
All right,
but
I'm not saying it's a moral obligation or not. I'm just saying it's also a costly one, initially, right?
It's a costly one, but you know, I was a legislator for 8 years of my life. I did the first smoking ban in the United States of America, and the restaurants kept saying, it's a disaster, it'll ruin us. It's just not true. We're always on the brink when it comes to finances, at least on our
Well,
local.
Carrie, what do you think of that? We whine and moan about how much it's going to cost, and ultimately it's okay. What do you make of that?
No, the good thing, we have examples of universal health care around